Drug overdose is a critical medical emergency that can happen with prescription medications, recreational drugs, or alcohol. Timely intervention can save lives. Today we'll learn how to manage an overdose situation step by step.
Welcome everyone. Today we'll discuss the basics of managing a drug overdose. The first rule in any medical emergency is to remain calm and act quickly, because every second counts.
The first step in overdose management is recognizing the symptoms. Overdose symptoms vary depending on the substance, but here are the most common ones.
Look for signs such as loss of consciousness or being unresponsive, difficulty breathing or slow breathing, pale, blue or cold skin, vomiting or choking, seizures, extreme confusion or erratic behavior. If you see any of these symptoms, act immediately. Do not wait for the person to wake up or sleep it off. Overdoses can be fatal within minutes.
The second step is to call for emergency medical help immediately.
Urgently dialing 911. Hello, I think my friend overdosed. He's barely breathing. We're at 125 Willow Avenue. Please hurry.
Calling emergency services is critical. Tell them the location, the condition of the person, and what substances may have been involved if you know. Don't worry about getting into trouble. The priority is saving a life.
While waiting for help to arrive, start basic first aid. Here's what to do.
If the person is breathing but unresponsive, place them in the recovery position. This will keep their airway open and prevent choking if they vomit. If the person is not breathing or their breathing is extremely shallow, you may need to perform rescue breathing or CPR. The emergency operator can guide you through it if you're unsure.
In cases of opioid overdoses, naloxone, also known as Narcan, can reverse the overdose if given in time.
Naloxone is a life-saving medication that can rapidly reverse opioid overdoses by blocking the effects of opioids on the brain. If you have naloxone, administer it right away.
The bystander follows the instructions on the naloxone nasal spray.
Make sure to follow the instructions, which are usually straightforward. Place the nasal spray in one nostril. Press the plunger firmly. Monitor the person for improvement. If they don't wake up after 2 to 3 minutes, administer another dose.
Even if the person appears to recover after naloxone or other first aid, they still need medical attention. Keep monitoring them closely.
Sometimes people can relapse back into an overdose state, especially if the drug stays in their system longer than the naloxone. Continue monitoring breathing and responsiveness until medical professionals arrive.
You're going to be okay. Stay with me. Help is coming.
When medical professionals arrive, provide them with as much information as possible. What the person took, how long ago, and any first aid given.
Remember, overdose victims often need to be monitored at the hospital for several hours, even if they seem to recover. Some drugs, like opioids, can have delayed effects, and a second wave of symptoms can occur.
The paramedics take the patient to the ambulance, and the bystander gives them the naloxone kit and any relevant details. Preventing overdoses is just as important as knowing how to respond to them. Be aware of the risks, know the substances involved, and encourage safe practices.
Remember, drug overdose is a medical emergency, but with quick action, many overdoses can be reversed and lives can be saved. Don't hesitate to call for help, administer naloxone if you have it, and provide care until professionals arrive. If you or someone you know uses opioids, having naloxone nearby can be the difference between life and death. Make sure you know how to use it, and never hesitate to act in an emergency.
By learning these steps, you can make a life-saving difference in a drug overdose situation.